I was wondering if you could talk a little bit. You spoke about the role of the midwife in women's lives, right? Generally in their lifespan. You could talk a little bit about their role specifically in the birthing process.
So a midwife takes care of a woman from the moment she goes into labor. I'll expect a phone call giving me a heads up that she's in labor, and I will either meet her at the hospital or go to her home. As you know, midwives, 90% of us are in hospitals, another 10% outside the hospital, in either home settings or birth center settings. And so I will, meet her at the hospital. Let's say we're at a hospital, and I'm going to meet her at the hospital and, check on her and the baby. So I have two patients, not just the woman, but also her baby, that I have to constantly keep track of. And I will stay with that woman throughout her labor for the most part, as much as I can, because that one-on-one care is the thing that really makes a difference as to whether or not she's going to need medication. So if she has one-on-one care from either a midwife or a doula, then, or a really good nurse, then it's less likely that she's going to ask for pain medication. And I can prescribe medication if she tells me she wants it. I'm not going to say, no, you can't have it. So if she says, I really want something, I can't take it anymore, then I'm going to say, okay, then that's your choice. As long as you know the choice and you understand the benefits and the risks to the baby also. And so midwives go throughout the entire labor, and then as the baby's being born, we help the baby out and hand the baby to the mom because it's her baby. And I actually like to have the moms reach down and help to take their own baby out, so the baby's just going right into their arms. And then we leave the cord to pulse for a little bit because there's stem cells in there that belong to the baby, and cut the cord a little bit delayed to let whoever wants to cut the cord is fine with me, it doesn't matter. And then midwives also, if there was a small tear or a laceration or whatever, we can suture also. And then we're going to keep track of any kind of complication that happens. So if the mother happens to hemorrhage or any, I can name a few other things, but that we are educated to take care of those complications. And then we follow the mom through the rest of her postpartum period. So after we help them to initiate breastfeeding if they want to breastfeed, which we strongly encourage, and bonding with the baby.
So how do you talked a little bit about birthing as something that's empowering to women. Can you talk a little bit about that more? How do you feel that is so?
Well, I think if you go through labor, and particularly if you go through a normal physiologic labor without taking medication, then you really get a natural high from that. And women will talk about how they are on cloud nine for 2 or 3 days following giving birth to a child. And that, I think, I say to some people, for me also, that it's a really ecstatic time for me as a midwife. And I often say to people, some people do drugs, I like to do births, because that's that kind of sensation, even for the people that are in the room. So, but a mother comes through that knowing that she is handled, that you're not going to get more than you can handle, and that your body is designed to give birth, and we don't have to intervene with that. The only intervention that we need is support. And once you know that you have the supportive people around you to give birth, then that makes giving birth that much easier. And going through that whole entire process makes you come out of it on the other side of it, as I said before, like a lioness. Like you're ready now to step into motherhood. You know what it means to have gone through what you went through to get your baby there with you. And you just walk into it like, okay, I'm a powerhouse now. If I can handle labor, I can handle anything. Which means you're going to be much more protective of your child as a mother, and you're going to be, just in a really, really good place with yourself. And I think that that's very, very important in terms of that parenting is not easy, and getting a good first step and a start in the right direction makes for good parents also. Not just the woman, but also the partner. So the partner is empowered also by this very positive experience. And when a woman walks away from a vaginal delivery, she walks away from a vaginal, once the baby's out, the pain is gone. It's done, you're done, okay? You have a cesarean, you've got 2 to 3 weeks to deal with in recovery. And so it makes it much more difficult to bond with your baby. Sometimes it interferes with breastfeeding, it interferes with the rates of infection are higher, you're doing major abdominal surgery when you do a C-section, and most people don't realize that it is major. I know it's an operation that we do frequently in this country, but it's still major abdominal surgery. So during a C-section, if you need a C-section, which is a life-saving operation, for example, if your baby is not adjusting well, or if the cord is being compressed, because that's where the oxygen comes through. If the cord is being compressed somehow, these things can happen. And then a cesarean is life-saving and you're happy to have it. And you don't even think twice about it. And on but you want it to be necessary. That's the whole idea, is that it's a necessary section, not an unnecessary section. And in those circumstances, midwives can first assist, which means that the doctor cuts and I sew. So that means gives a continuity of care also for that mother. I'm watching over to make sure that everything is going smoothly during that operation.
Great, thank you. So do you think there are particular social attitudes that people, communities, society has towards natural childbirth?
Well, I think the more women get informed and the more educated they are in terms of childbirth, that when you see things like The Business of Being Born or the more popular movies that are out now about childbirth, like Call the Midwife, that type of media really helps women to understand that they need to think about this. Don't walk into it blindly and let someone tell you what to do. You need to know about your health, about childbirth. You need to know about it for your sake and for your baby's sake. And being a good mother means that you get informed. And I tell women when they're pregnant, you don't become a mother when the baby's born. You're a mother from the minute you conceive that baby. You have to take good care of yourself. You have to feed yourself well. So I think that the cultural society views, so there's two sides to this. There's the women that are informed, that know what they want, that know that childbirth should be protected, and that we need to honor it and honor it as the natural process that it is. And then there's the group that wants to sign up for their C-section and wants to do it on a convenient day, and that's a different set of women. And then there's the larger majority that just walk into it blindly and say, well, whatever my doctor says to me, that's what I'm going to do. And sadly, that's probably where our highest C-section rate comes from. And so we just need to keep spreading the word over and over and over again to women to think about what you're doing and why you're doing it, and what's the best for you and the best for your baby.
And so there has been, in recent years, I was looking at a New York Times article that looked at, arguing that the role of midwives has increased. Midwives are more in use today. We have midwifery school, right? So do you see this as, positive contributions, the growing role of midwives? Does it say something about the particular turns or transformations that our society is going through?
I think that because of the internet and the easy access to information, that people are understanding a little bit more about midwifery, and more interest in midwifery is growing. Also, I think that the media can be both a help and a hindrance sometimes, but for the most part, that it's been had a positive influence on the growth of midwifery in this country. We are graduating 500 midwives every year, give or take a few, and that number is up from just a few years ago, which was like around 370. So we're doing, the numbers are increasing. In this country, we deliver probably about 8% of the babies here in this country, or we attend women that are delivering 8% of the babies. But in other countries where midwifery is the norm, they're up to 70 to 90%, where it's midwives doing all of the continuity of care and all the pregnancy care and all the birth care. And I think if we did that in this country, we would definitely have a decrease in our healthcare costs. we'd have a decrease in our C-section rate and all of the sequela that comes from that, like infection, et cetera, et cetera. And, it's very expensive to have a C-section as opposed to a vaginal delivery. So this cost savings alone in decreasing the C-section rate would be phenomenal. So I think that's the thing that we need to think about in terms of midwifery growing. What does it do for the country? So the World Health Organization recognizes that midwives should be the primary caregiver